a week now, 1,000 employees have been waiting for word on when they will lose their jobs. Tonight, KITV4 News has learned that the bulk of hospital workers at Hawaii Medical Center East and West are expected to be laid off Christmas Eve. We have the exclusive story now from KITV4's Catherine Cruz.
3 days before Christmas, and Nikki Ramos isn't feeling very merry. A surgical technician at HMC West, she said the mood at the hospital is anything but joyous.
Everybody's devastated. I can see that people are, going into depression. I mean, there's a lot of crying.
Ramos was working last Friday, the day of a planned Christmas party. She said no one knew what to think when it was suddenly called off.
It was announced overhead via the, intercom that it was canceled.
They were then told their emergency room was to shut down 3 days later. HMC is expected to make an announcement about the hospital's general operations tomorrow. Sources confirmed that the 5 unions, which represent the 1,000 workers, are anticipating that some of their members will be laid off Saturday.
Through informal discussions, we understand that it could be as quickly as this weekend where people begin getting notified.
The Labor Department began meeting with the soon-to-be displaced workers yesterday.
In the past 48 hours, about 24 meetings to begin the dialogue so that we can start providing information.
And the Nurses Union, which represents 300 RNs at both hospitals, has been checking with 27 other healthcare facilities about trying to place their members.
They are specialty nurses. They have a lot of experience, and we're confident that most of them, if not all, will find positions elsewhere.
But for the LPNs, nurses' assistants, technicians, clerks, and security guards, it may not be so easy. Ramos says she's about to lose her townhome, and she worries about rent and car payments now that she's out of a job. Her husband, a carpenter, has been laid off for most of the year.
What do we do now? We can obviously get some nice letters. The doctors have offered to write us letters, but if the positions aren't there, they're not there. So then what?
Now, obviously, the hospitals can't completely shut down if there are still patients in-house. We're told as of midday today, the patient count was about 60, down from 150 last week, but the transfers were already starting. The Hawaii Nurses Association says its nurses will be among the last to leave. It believes it could take about 2 weeks to find beds for patients at other facilities. And one person told us that renal patients and those with Medicare and Medicaid are among the most difficult cases to place. As for the workers, we'll just have to see if some of those pink slips actually start coming, maybe even tomorrow. Back to you.
All right.